The majority of my videos are about complex chronic illness, but it turns out that folks who are suffering with complex chronic illness also have just quote unquote regular people problems too sometimes, including allergies. And just in the last couple of weeks, I've had a few patients who are unfortunately suffering from fall allergies. September in the maritime provinces is not necessarily a super common time for people to have allergies, but it does happen sometimes. And so, just a little friendly reminder that there are some really great natural therapies that can be used to help to address allergy symptoms if they are present. As per usual, nothing that I'm saying in my video should be construed as medical advice. This is all for informational purposes only. But what I found in my practice to be really helpful is quercetin. Quercetin is a pretty common supplement that's used to help address allergies. And granted, it's not a magic bullet for every patient. I find that in a majority of patients, it's at least helpful. Some patients find that it's a game changer for them. So it's definitely something worth considering in my experience. And then the other thing, which is kind of my ace in the hole, is low dose allergen therapy, also known as LDA therapy. And with LDA therapy, it can be used for a wide range of different allergy types. But there's a specific formula called the environmental mix, and that has every environmental allergen you can possibly think of in it, from pollen to pet dander to dust to mold spores, pretty much just anything you can think of that people might be allergic to out there in the environment, hence calling it the environmental mix. So the low-dose allergen therapy, I actually use this LDA therapy in a bit of a different way than is traditionally used. I kind of worked with several different methods using the LDA therapy, and so there's a specific way that I use it here in my practice. And quite frankly, even the traditional way of LDA therapy oftentimes is very helpful for patients. I've tweaked it over time and seems to work even better in this other way that I'm using it. But those two therapies can work very well in synergy. The quercetin works to stabilize mast cells, which prevents the release of histamine in the first place, which really helps to reduce that overall histamine load. And then the low-dose allergen therapy, as best we can tell, it seems to actually work to reverse the allergic process. So it actually really helps to address the root cause of what's happening with that allergy phenomenon that's occurring in the body. So it's kind of the 1-2 punch that I use for the majority of my patients. There are other factors to consider, like diet and other things that might be triggering mast cell activation and whatnot. And that's, in folks who are dealing with allergies and have mast cell activation syndrome, that can be a whole other kettle of fish. But whether a patient's suffering from complex chronic illness or not, these are some of the allergy remedies to think about. So I hope this information was useful. If you have any questions about this topic or anything else, just post in the comment section below, and I will leave it there for now.